past 4 o'clock, and then I think we might just call a little bit early today. Okay, if you want to get kind of a lecture lead-in as part of this. Okay? The next thing on the list deals with isometric exercise. Okay, so now we're starting to go ahead. Even though we've got contractions right here, where you're kind of using various forces, now you're going to try to do it a little bit different manner. You're going to try to get good, strong contractions of the muscle, all actively in this case. Okay, and what we haven't really talked about is that when you actually perform these exercises, there tends to be a window of overflow or carryover that exists right here. Okay, and what I mean by that is I've got poor Julie lying down here in a position like this. She is on her back. She's going to do an activity of trying to activate the quadriceps here, okay? Activating the quads in this position and not moving at all. What's that contraction? That tends to be an isometric contraction. Right? Now, what we also come across here, right now,
I guess so.
okay. Now, what happens here is that muscles recognize the task being placed on them in the sense that as far as strengthening goes, in this position, when you have a person all the way out straight here at the knee, okay, when you are strengthening someone in that position, strength gains tend to center around that position, okay, because isometric is a functional thing, and the strength gains from that functional position, not moving, tend to remain very close to that spot. You might see people argue anywhere between somewhere around 10 degrees on either side of the position as to where you see additional gains in strength, to as much as maybe a 20 degrees on either side, 15 to 20 degrees. Okay? So add it all up, you're talking 20 to 40 degrees on both sides of this position. Make sense? Another thing that takes place right here, hold on, is, okay. Okay. We're going to go ahead and this actually is a very good, core stabilization exercise. It's the laugh suppression exercise where, the subject tries to stop, laughing, and it's a very good abdominal exercise, right? So there we go. Okay. What happens here is I'm going to go ahead and ask Julie to get a contraction here, but that's her bad leg all of a sudden now. Any ideas on how your brain kind of works? You may have talked about this in motor learning. What you can do to kind of augment that? I'll say, guess what? Julie, instead of just trying to contract this side, I want you to do what?
Contract both.
Yeah, do it bilaterally, okay? So go ahead and contract bilaterally. If you can activate the good side, okay, that's non-pathologic and asymptomatic, you can get this overflow to the opposite side. Okay? So that's a good way to go ahead and get things started. Guess where it's going to be easiest to get your best possible isometric contraction? And don't get me wrong with the position is. Cameron, what is it? What's the best position you think to get a good, strong isometric contraction? Oh, someone said that. Any muscle. Resting length, right? You want to put them in resting length. Why would that be the case, guys? Yeah, they'll have maximum overlap of actin and myosin, okay? So by putting someone in that position, okay, of resting length, you'll get the strongest contraction and the easiest place to start. Now, does that mean that you only do isometric exercises in this position? No way. You'll do isometric exercises in the positions that require function for that person. Okay? They need to stabilize in a certain position, upright standing, keeping the lumbar spine in an extended position, which might be some short position for those muscles. Director speed aid, you have to work at that. Okay? But again, if you're just starting, that's a good spot to start, in the mid position, the resting length. Got it? Okay. As far as contractions go, we're going to have you guys run through some of these things. The things I'm going to have you kind of work on here are going to be the following. Number one, you want to make sure you give good, identifiable instructions to the individual who's performing the exercise. Okay? And it's one thing is, contract that muscle. How many people, patients that is, know contracting? Some, that's about it. Okay, not all. Okay, what are some other things? What's that, please? Squeeze, very good. What else can you say?
Tighten your leg up.
Tight, yeah, we use that for the patients. We try not to use the word tight for ourselves, but yeah, tighten up that muscle, okay? Any other things?
Make it hard.
Push.
Hold.
Pull. Okay, use words that they understand. Okay? Now, how do you want to set up your contraction? You want to have them go full blast right off the bat? No. How are you going to do it? Slowly build up into it. Give me a good strong contraction. Hold around that 6 to 10 seconds, and then slowly relax. Okay? Isometric. Now, I'm going to give you guys a chance to kind of see some of these. I think they start with something as simple as a quad set. Okay. A lot of times, status post surgery, you end up with an individual. You come out of surgery, guess what happens to those quads? Big, gigantic, cross-sectional, muscle. Strongest can possibly be. And guess what? What's that, Mariana? Ooh, down the hill they go. That's exactly right. Did you become weak just in those few hours in surgery? Not that weak that you couldn't move it at all. But a lot of times you'll get into the reflex inhibition. Okay? That ends up where, for whatever reason, the muscles just have automatically shut down. And it's great to see. I think I may have mentioned this sometimes with swelling inside a joint, where I've seen people who've had like the suprapatellar pouch and the joint capsule so swollen they couldn't extend their knee at all. They go in with the physician, he aspirates the joint, takes out copious amounts of really yucky synovial fluid. The swelling is all gone, and guess what the person can do? Extend that knee out right away, no problem, they stand up and walk. It's real. Doesn't mean that some of that synovial fluid and swelling won't come back. But by getting rid of it, it gets rid of that inhibition as well. Okay? So if you take a look at some of the basic exercises, the first one there is a quad set. Again, you're not necessarily strengthening the muscle through range here. You're trying to obtain activation. So I've got my patient here, Julie. She's going to go ahead and do a quad set. Ideas, and for falling down, I'll show those in a second as well. As far as how you want to get the person to activate these muscles, what can you do to get that to take place? Take these muscles, go ahead, tighten this muscle up, tighten it, that's it. You might understand that way. Another thing you might say to the person.
Push your knee down into the table.
Yeah, push your knee down into the table, okay? Or, here's my favorite, and you can actually see it happening. You have to take this filter off here. Now, if I ask Julie to do it on this side here, go ahead, push your knee down on the table. And a lot of times, what do you see right here? Yeah, the heel comes up off the supporting surface. So, by asking that of the patient, okay, push your knee down on the table and try to get the heel up. They can understand that. You might get a very nice, strong contraction. Okay? So those would be quad sets. You can run through and teach them. You do multiple repetitions, multiple sets, multiple times a day, all that kind of stuff. All right? Next on the list, what do you have? Glute maximus. Okay? Very common exercise, again, to try to get the muscles activated status post surgery. We saw up there, typical way to do your total hip replacements is a posterior approach. You have to get them active. It was one of those things that you would get people to do it very, very well, and there's always some that never got it right. And of course, it took another, 65-year-old, lady to kind of set me straight. And I was trying to go ahead and tell Julie, okay, Julie, I want you to go ahead and contract the muscles back here. Go ahead and contract these muscles. And I could get people pulling their heels down into the table, okay? Which is actually could be a hamstring set. We're trying to extend the hip, but there'd be no contraction of the gluteus maximus. Let's say, go ahead, pull those heels down there. Or no, she's good. gluteus maximus contraction. But you could actually see it where the person would try to pull their heels down, but they're not contracting the gluteus maximus at all. Just right there, just pull your leg straight down, your heel down in there. Don't bring your knee up. And I'm not getting any contraction there. Okay. She's very good at that. She can do exactly what I asked. So you get people like that. They would be, after surgery, they could not get a contraction. You want to try to do so bad. And finally, this woman got it. You know? And I said, that's it, you finally did it. Well, now you tell me. What did I do wrong now? If you had just told me the right thing in the first place, I wouldn't have had this problem. What do you mean? She goes, well, all you gotta do is just tell me I'm trying to take the quarter off my butt. Oh, got it. Okay. And I use it as a last resort. It works perfectly good. I go up to Julie and say, okay, Julie, I know you're having difficulty, you know, trying to get this gluteus maximus set here, but just try to think, you're trying to pick up a quarter with the cheeks of, you know. Go ahead and try that, and I'll, oh, there you go. Okay, so it's, again, the core stability exercise of the abdominals. Use of words makes all the difference in the world. I mean, I can kind of tell you what has worked for me in the past. I'm sure Rachel and Brandon and Mike, you guys have some great cues as well. Anything you want to throw out there that you guys like to say, or anything, or particular exercises that you know work well with cues that you know aren't so good with others, or?
I mean, it definitely helps to say something like giving some manual and verbal cues together, so that they know, like pointing to the muscle, being like, can you tighten this up here versus being like contract your quads, because they're not going to understand that.
Yep. And you'll see like people put like a towel, they'll take it this way and they'll roll it up, or a hand underneath the knee. And if I ask Julie to do this, okay, go ahead and squish that towel down there, okay? As she tries to squish that towel down, what's else happening here? You see what? The heel come off there. What's she actually doing? What exercise? Very good, okay? So what else do we have on there as far as some of the isometric quads, gluteus maximus, hamstrings, ham sets, okay? Trapezius, middle and lower, okay? I'm gonna hold on that. What I'm gonna have you guys do is go through some of the isometrics to that point, because we get into the trapezius,